Semantic feature analysis and its approach to the treatment of aphasia. What is semantic feature analysis? Semantic is word meaning and word relations, so the content of language, its vocabulary. Feature is its distinct attribute or aspect of a specific target vocabulary word. And analysis, the examination of the elements of these distinct features. Here is an example of a semantic feature analysis chart. The clinician would put the target object in the middle, ask the client to name it, and to describe its features. For example, what category does it belong to? How would you describe it? What do we use it for? Etc. This treatment approach is used for patients with word-finding difficulties, a common characteristic of patients with aphasia. What is aphasia? According to our textbook, aphasia is a neurogenic cognitive communicative disorder caused by injury, abnormality, or disease in the adult nervous system. It impairs comprehension and production of language, usually caused by damage in the left hemisphere of the brain. According to ASHA, aphasia is a communication disorder that results from the damage to parts of the brain that contain language, most often caused by a stroke, resulting in symptoms of severity depending on the location and extent of the brain damage. It focuses on the difficulty producing language, difficulty understanding language, and difficulty reading and writing language. Here we have Darley's definition of aphasia. This one is the most comprehensive and widely accepted definition of aphasia. It contains 5 components. First, a patient must present with brain injury, an acquired disorder that is not developmental. Second, the deficit is in all 4 modalities of verbal language. Third, these deficits look very different according to their severity and location of the injury. Fourth, the deficit is with words. So this is disproportionate to impairment of other intellective functions, and it's not attributed to dementia, confusion, sensory loss, or motor dysfunction. Fifth, its problem with words is in 3 main avenues. Problems with reduced availability of words, problems with reduced efficiency of word retrieval, and or problems with reduced auditory attention span for words. Here we have a diagram of the left hemisphere of the brain. In yellow is Broca's area, located by the primary motor cortex. This is responsible for speech production. Then we have Wernicke's area, responsible for speech comprehension. Damage to Wernicke's area would develop Wernicke's aphasia, also known as fluent aphasia. Damage to Broca's area would result in Broca's aphasia, also known as non-fluent aphasia. Here are the different types of aphasia according to the National Aphasia Association. Global aphasia being the most severe form, Broca's aphasia, also known as non-fluent aphasia, where speech is halting and effortful, mixed non-fluent aphasia, with patients who have sparse and effortful speech and limit their comprehension of speech, Wernicke's aphasia, also known as fluent aphasia, where patients have long connected speech but with unmeaningful words and jargon. Anomic aphasia, where a person is left with the inability to supply the words they want to talk about. Use lots of circumlocutions and expressions of frustration. There's also primary progressive aphasia, which is a degenerative disease that is a type of dementia that affects the brain tissue that is important for speech and language. Here we have the definition of non-fluent versus fluent aphasia according to our textbook. Non-fluent aphasia, also known as Broca's aphasia, difficulty planning speech movements. Words come out slow with disarticulations and distortions, and speech is considered to be agrammatic and telegraphic. Then there's fluent aphasia, also known as Wernicke's aphasia. The patient has difficulty comprehending speech. Words come out fluently in long, complex sentences, but with jargon and unrecognizable and unnecessary words. Here we have the neurobehavioral characteristics of a person with aphasia. Main characteristic is anomia, word finding difficulties. And this is what the semantic feature analysis treatment approach is targeting. Next, we have errors in speech production, either very little or abundant speech. Difficulties with auditory comprehension, difficulties with repetition. But these patients are very aware of their self and their environment. If there's no damage to the right hemisphere of the brain, this patient has great grammatic, pragmatic, and cognitive skills. Next, we'll discuss the evidence-based practice treatment articles. Semantic feature analysis has been found to be successful for deficits in lexical semantic production in both fluent and non-fluent patients. The typical procedure would be to show the object, ask the client to name it, ask them to describe features, and then ask them to name it again. The first article I wanted to discuss was from 1983, and it's the effect of semantic feature analysis on reading comprehension of learning disabled students. I found this article really interesting. Though it's not about aphasia, it shows that semantic feature analysis works for adolescents with learning disabilities. It results in significantly improved vocabulary knowledge and reading comprehension. Next, we have an article by Boyle that discusses semantic feature analysis treatment for anomia in 2 fluent aphasia syndromes. There's 2 participants, one with anomic aphasia and one with Wernicke's aphasia. They use semantic feature analysis to teach nouns in categories that included vegetables, insects, birds, containers, clothing, etc. And this resulted in a significant improvement in confrontational naming of treated nouns and also a generalization to untreated nouns for both participants in the study. Here we have the semantic feature analysis graph that was used for the treatment. In the middle is the target picture, and it's surrounded by 6 different features. Next, we have an article about using semantic feature analysis to improve contextual discourse in adults with aphasia. Here, they were taught to story retell and procedure explanations using episodes of TV shows. So these are visual cues. The results were participants improved naming abilities for treated words, but unfortunately there were no generalization to untrained items. Here we have a graph showing the different video clips used to teach the participants about procedures, how to plant a flower in a garden, how to change a tire, how to make a pot of coffee. Lastly, we have an article from 2015 using semantic feature analysis to target verbs in a quadrilingual speaker with moderate non-fluent aphasia. This individual spoke Japanese, English, German, and Norwegian. And the results were he improved significantly on trained verbs, but unfortunately, again, there was no generalization to untrained verbs. Here we have the semantic feature analysis chart that was used for him, very similar to the other two that we talked about. I think these articles are important because it shows that though some have a generalization, the ungeneralization could result from the brain damage of an aphasic person. So we're essentially reteaching all of these target words to our clients. So we would concentrate on categories that are important to our specific client. So for example, daily living skills, ordering their favorite cup of coffee, speaking to their family members, anything that would improve their quality of life and follow the WHO wellness approach model. So we would use this treatment approach to help clients with aphasia in improving their word finding skills. Here are my references, and that's it. Thank you.